Hi there. Thank you for clicking on this link for today's Medicare 101. I'm Susan Shimp. I'm with the Medicare Gals, the signature team, and I am here to teach you all about Medicare. It's exciting for some of you, but this is very complicated, and I'm here to basically help you understand Medicare, understand all your options, how to stay protected because there's so many ins and outs of Medicare that you just can get overwhelmed. So I'm here to help with that and guide you along the way. So what you're going to learn today is how Medicare works. There's a lot of moving parts to Medicare. So we're going to go into that. We're going to talk about when you should enroll, how you can enroll, all these different situations and scenarios. Also, look at two main Medicare paths that people can take and what's best for you. Also, common mistakes that we see. There's a lot of enrollments and penalties and stuff like that. So, we are going to go over that. Medicare doesn't cover everything. So, it does leave exposures and gaps. So, that's where I'm going to come in and kind of give you information on how to cover those gaps and exposures. And of course, as Medicare insurance brokers, how we help you guide you and teach you and hold your hand through this throughout the years because it does get complicated every year. So I want to introduce my signature team. I am Susan, obviously, and my team is locally based here in the New Braunfels, San Antonio area. We are independent Medicare insurance advisors. So we are there for you. We work for you, not for the insurance companies. We are considered your fiduciary. Okay. So we offer ongoing support, not just at enrollment time. So once you see us, you will continue to see us and hear from us, and you'll be able to talk to us via our cell phones. We are education focused. We are always there to teach you and to educate you on all the ins and outs, all the new rules, all the new laws that are coming in. We can do it in person, but we can also do it digitally. So I want to introduce you to my staff. Mary, she is on the left. She is my client concierge. She will be your first point of contact when you call our office. And she's amazing. Everybody loves her. She's got a great personality and she will make you feel warm and comfortable. Miriam, she's my licensed agent on my right. She is outstanding. She is also a Spanish speaker. So if you need someone who speaks Spanish, she can definitely assist you. And she is a rock star. She will definitely be able to assist you and answer all the questions that you have. And of course, I'm in the middle. I'm the owner. I'm an insurance broker as well. And I am also there to help lead my team and answer any questions. Of course, we do have an actual office that if you wanted to come to, we are located in New Braunfels, just south of Bucky's at 2090 North I-35. We're in Suite 4117, and that's in New Braunfels off the frontage road. You can also call us at 210-767-9876. That's a call or text. And you can also go on our website at medicaregals-st.com. But you can also find us on Facebook, on Instagram, on YouTube, and on TikTok. So we're all over the place. So you always have access to reach one of us. So let's dive in. You ready? So grab paper, grab pen, and we're going to get into the basic information about Medicare, and then we'll dive into the plans. So original Medicare is what we're going to focus on first and teach you about the two parts of Medicare. So like I said, Medicare is originally just two parts, okay? You've got Part A and Part B. Part A is your hospital coverage. That's all your inpatient coverage that you receive. There is no monthly premium for that. You have already paid in 10 years into your paychecks. So there's no monthly premium for that. Okay. So that's a good thing. Now, Part B, as in boy, is your doctor coverage, is your medical coverage. That is where you do pay a monthly premium. And that monthly premium is standard for 2026 is $202.90. Okay. So that's the standard monthly premium that everyone across the country is obligated to pay for Medicare. Medicare is not free. That is one of the biggest mistruths, because Medicare is not free. So some people pay more and some people pay less. So if you pay more than the standard Part B premium, which is $202.90, that's because you have higher income. Okay. So Medicare looks at your tax returns. So from 2026, they look back 2 years. So they're going to look at 2024. And if you're over a certain threshold based on how you file, if you file single or jointly, they're going to look at the incomes. So this is called the IRMA. And this is an IRMA we don't like. So basically, if you make more than a certain amount, you're going to pay more than the standard monthly premium for Medicare, which is $202.90. And we can dive into that when we get into your specifics. Now, when it comes to enrolling into Medicare, not everybody has to enroll in Medicare. I know everyone's like, I got to enroll in Medicare, I'm turning 65. Not necessarily. So there are different scenarios that we would want to look at to see whether or not it's beneficial for you to enroll in Medicare now. So one, if you're receiving Social Security benefits already before the age of 65, that's one scenario. Second scenario is that you're not receiving Social Security benefits. And then third scenario is, what if you're still working past the age of 65, or say you're covered under your spouse's employer plan? That's a third scenario. So we're going to look at all those. So scenario one, so you're collecting Social Security. You started collecting it early. And this is where it's the easiest thing for Medicare beneficiaries. This is where they automatically enroll you into Medicare. Usually 3 months before your birthday, you will receive your Medicare card, the red, white, and blue card. And what's going to happen is that you're going to be enrolled into Medicare automatically, but they are going to take out and deduct the Medicare premium, which is $202.90 automatically out of your Social Security check, no matter what, right? So it is taken out before it even hits your bank account. So that's an automatic Medicare enrollment that you would not have to worry about. Now, what if you're not receiving Social Security benefits and you need to enroll into Medicare? Then you must do it manually, and you're going to do it on the Social Security website, okay? So you're enrolling into Medicare, but you're doing it on the socialsecurity.gov website. So if you don't have an account already, you're going to make an account, and then you're going to sign up for Part A and Part B. Now, because you're not drawing Social Security benefits and they can't deduct that Medicare premium because you're not drawing benefits, how are they going to bill you? They're going to bill you quarterly. So they are sending you a bill for $202.90 times 3 months. And then you're just going to pay them with a check or online or however you want to do it. But once you start your Social Security benefits, then they will start to take it out monthly, and you won't have to even worry about paying quarterly. The third scenario is, well, I'm not going to quit working. I'm going to stay working at past 65, and I'm covered under my work employer plan. Or if you're not working, but you're covered under your spouse's employer plan and he's or she is still working, then you're fine. You don't have to get on Medicare necessarily. You may be able to delay Medicare coverage because you are covered under an employer insurance, which is considered credible. Now, here's the key. The key is the employer must have at least 20 or more employees in order for you to stay on your employer plan without getting on Medicare, okay? 20 employees. So what if you continue working past 65 and then you want to get on Medicare because you retired, you lost your employer coverage, or you were laid off, something like that? That gives you a trigger to enroll into Medicare as a special enrollment, and it would avoid any penalties because you've had that credible coverage past the age of 65. But there's forms you would need to fill out, and we'll go over that. But Sometimes Medicare plans versus the employer plan can be a lot different. So we do a side by side comparison to kind of see what would be the best fit. And 9 out of 10 times, the Medicare plan is usually better than the employer plan due to high deductibles and high premiums. So we'll look at that. So those are three of the basic scenarios. So when you're enrolling into Medicare at 65, that's called your initial enrollment period. So it's a 7-month window that you have a chance to enroll into Medicare and get on a plan. And it's usually 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after your 65th birthday. So for example, if your birthday is May 13th, you can begin enrolling into Medicare starting February 1st, and your 7-month window will end August 31st. So that's your initial enrollment window. And that's when you can enroll into Medicare at the age of 65 without any penalties if you are not working or you don't have any kind of employer plans. All right, so we're getting into now of the exposures of Medicare because there's a lot of exposures of Medicare that people don't realize can be a financial risk. So if you have a paper and pen, I would advise you start taking notes if you haven't already started taking notes. But definitely, this is where a lot of the numbers will be thrown out, and it's going to get a lot of complicated, but I'll make sure it's definitely easy for you to understand. So, when it comes to the exposures of Medicare, Part A, your hospital, there is a deductible that you are responsible for paying every single time you go into the hospital. So, this is on Original Medicare. Your responsibility is $1,736 each time you go into the hospital. That's expensive. That's a lot of money just to go in one day or 5 days. But then you leave and you go back in again, it's another hit of $1,736. Part B is your doctor medical coverage. This is where your annual deductible, you have a one-time annual deductible, it's not per doctor, one-time annual deductible of $283. And that's again one time per year, you pay that. And then this is where it can get really expensive. Your cost is 20% of everything with no maximum out of pocket. So Original Medicare covers 80%, but you're responsible for 20% of everything. No maximum out of pocket. If you have a hospital stay of $100,000, you're responsible for $20,000. So this is where the exposures of Original Medicare without getting on any additional plans can get very financially risky if you're catastrophically sick. So we're going to talk about how you can help eliminate these exposures by getting on certain plans. So there's two options that you can get: Medicare Supplement and a Medicare Advantage plan. They are completely different plans. They are run completely different. But again, there's no wrong way. It's just how do you want to get your care and how do you want to pay for your care? So let's go into the options. So Original Medicare on your left, you've got your Part A and your Part B, red, white, and blue Medicare card. With that, you can add a Medicare Supplement plan, which is also known as a Medigap. It gaps the 20% that Medicare does not cover. But you would have to also add a prescription drug plan with that. So your Original Medicare, your Medicare Supplement, and your prescription drug plan, 3 plans, gives you the comprehensive coverage. Or you can go the Medicare Advantage route, which is also known as the Part C. So Part C basically combines all your medical into one plan, plus your prescription drugs into one plan, but it also gives you additional benefits that you don't get on Original Medicare. So you get gym memberships, dental, vision, hearing, and sometimes over-the-counter benefits. So this is an all-inclusive plan. It's kind of like an employer plan, how it's run, but it's completely different on how you pay them. And we'll go into those a little deeper. All right, so let's start with option one, your Medicare supplement plan, aka Medigap. Gap's the 20% that Medicare does not cover. So you still have to pay the Medicare Part B to the federal government, the $202.90. Now, a Medicare supplement plan does cost a monthly premium. So it will be based on what insurance company that you pick, and we'll go over some cost in a little bit. With a Medicare supplement plan, it does give you the lowest out of pocket costs when seeing doctors or hospitals, because it does pick up the 20% for you. And when it comes to the network, there is no network. There, you can choose any doctor that's contracted with Medicare in the United States. No referrals are needed. So any doctor that's assigned to Medicare can take you. So that's usually about 98% of doctors around the country. So like I said, you do have to pick up a separate prescription drug plan to help cover your meds. And that's through a different company if you choose to cover your medications. Now, Medicare has 10 different Medicare supplement plans. Like, what the heck is this chart? So it's a lot of confusion, yes. But we're going to hone in on Plan G and Plan N. Those are the ones that are the most comprehensive plans that are available now for people who are turning 65. So we're going to go into Plan G and Plan N and kind of go into what those cover and what your out-of-pocket costs would be. So for example, Plan G is the most comprehensive plan out there. So your Plan G supplement plan would cost you between $100 and $200 a month, depending on where you live. It's going to be based on your zip code. And it's also going to be based on what insurance company you choose, because these plans cover the same exact things no matter what, because they're standardized by Medicare, but the insurance carrier can dictate the price on the monthly premium. So between $100 and $200 a month. Oops, I went back. Oh, there we go. Okay. So what's the difference between Plan G and Plan N? So here's the difference. So Plan G, usually, like I said, between $100 and $200 a month on top of your Medicare premium. Okay. Now, you would be responsible for paying the annual Part B deductible one time per year, which is $283. Once you pay that, there is no out-of-pocket costs for the rest of the year. Okay. So I kind of say this is like car insurance. You got to pay that monthly premium every month. You may not use it every month, but peace of mind knowing, hey, I've got coverage, and after my deductible, I don't pay a dime. Okay. Plan N is a little different. It's a little bit cheaper than the Plan G. You still are responsible for paying the one-time Part B deductible of $283. But the difference is that you may pay a copay to see a doctor up to $20. Okay. And if you were to go to the emergency room, you would pay up to $50 copay. So it has a little bit of copays on this one, but it's a lot less expensive. And you may be exposed to any Part B excess charges up to 15%. Now, mind you, I've been doing this for 12 years and I have never seen anyone get charged excess charges, because Medicare assigned doctors usually take whatever Medicare sends them as the payment, and they don't usually charge you the additional 15%. So they do add that in there, but it's very not common, so I wouldn't worry about that. Next slide. Sorry about that. Okay, sorry. Little glitch in the system here. Okay, key points about Medicare supplements. The best time to enroll is when you turn 65, okay? You are guaranteed issue into a Medicare supplement plan. You get the lowest rates, and there's no pre-existing conditions. So 65 is usually the best time to enroll into Medicare. You can also enroll after you lose employer coverage, because you also no pre-existing conditions matter, but you're guaranteed issue, so it doesn't matter. Now, all these plans, like I said, are standardized. They cover the same exact thing. A G is a G, an N is an N, no matter what insurance company. It's just dictated by the insurance companies what the monthly premium is going to be based on your zip code. So it doesn't matter if you go with Plan A insurance company versus Plan B insurance company. They're going to be the same, but one might be cheaper in the monthly premium. So we'll look at all that. Okay, so like I said, what we just covered was medical, covering all your medical costs. Now we look at what comes for your prescription drug coverage, which is required by Medicare. So that's a requirement you need to get. So prescription drug coverage, like I said, it's part of the three: original Medicare, your Medicare supplement plan, and then add a prescription drug plan. Those three work together in tandem to help cover you at um, a good comprehensive coverage that you're not exposed. Now, some people are like, well, I don't have any prescription drugs and I don't really want to enroll into a Medicare prescription drug plan, but Medicare is requiring you to. So if you enroll into Medicare, you have 63 days to enroll into a drug plan or you get penalized. Now, that penalty stays with you for life. So you definitely want to get a prescription drug plan, satisfy the credible coverage that Medicare requires, and then, you'll avoid any kind of penalties and you might get prescriptions later on in the future. So again, recapping: original Medicare, three parts: original Medicare, supplement plan, and a prescription drug plan. Okay? So with those three premiums, some people are like, that's expensive. I don't have enough monthly income to cover all that. What is the next option? So the next option would be a Medicare Advantage plan. It's called a Part C. This is the one you see advertised on TV all the time. All the ads, the mailers that you get, everything. This is what you see. So let's talk about what this is. So Medicare Advantage, the difference is how you pay for it. You still have to pay the Medicare Part B premium of $202.90. That's a given. You got to pay that. But the Medicare Advantage side, usually there is no monthly premium, okay? Zero monthly premium. But you're going to pay copays as you go to the doctor, as you go to the hospital, as you have a surgery, as you have an x-ray, that kind of stuff. So you're going to pay copays as you use it. I kind of say it's like an a la carte. You pay it when you use it. Now, on a Medicare Advantage plan, this is a network, an insurance network. You must choose doctors that are inside the network contracted with your doctor and the insurance company. So it's kind of like an employer plan where you still would have the network of doctors that you have to, see to stay in the network. Prescription drug plans typically are included in the plan. You don't have to get an additional plan. And you do get extra benefits in these plans. Most of these plans include dental, vision, gym memberships, over-the-counter benefits, hearing, all that extra stuff to keep you healthy. So the reason they do that is because they want to keep you as healthy as possible. The more you stay healthy, the more you stay out of the doctor's office. It's cheaper for you. And then these insurance companies make money off of you. It's a business, but that's kind of how it works. So it's an advantage for you to get all these additional perks. Now, when it comes to a Medicare Advantage plan, there's two different plans you can go into. There's HMO plans and then there's PPO plans. And I'll explain the difference. And some of you may know, but I'll kind of give you a refresher. So Health Maintenance Organization is an HMO. This is network-based. You must have referrals to go see specialists. So your primary care doctor is your gatekeeper, I say, and they have to refer you out to see your specialists. You do get lower copays and your overall cost with richer benefits on the plan. So you do get a little bit more perks. And then you do have nationwide and worldwide emergency coverage allowed on these plans, but you can only see doctors within your service area. Okay. Now, on a PPO plan, it's also network based, but you have an in and out of network benefit. You can go in network where it's going to be a little bit less expensive, but you can go out of network as well and pay a little bit higher cost for that. No referrals are needed. So you can come and go to your doctors as you please. You have a freedom to choose your doctors, and you do have doctor access nationwide because it is a PPO. So you can go see doctors in Indiana, you can go see doctors in Florida, you can go see doctors in Dallas, it doesn't matter. And you still have national and worldwide emergencies on these plans. Both plans cover emergencies regardless. So again, it's no one size fits all. It's what's best for you. How do you want to get your coverage? So when choosing a Medicare Advantage plan, there's a lot of different factors. We're going to look at your zip code and county because one county could have a completely different plan than the other county. So we always want to make sure that we're looking at the benefits based on where you live, doctors that you see, medications you take, hospitals that you prefer. We're also going to look at what's important to you. Do you want the gym benefit? Do you want extra dental and vision, hearing coverage, over the counter benefits? So we're going to look at all that, and all those factors kind of tie in to finding you the best option for you. So breaking it down between the two: Medicare Supplement, Medicare Advantage. Medicare Supplement, Medicare Advantage, both plans, you have to pay the Medicare premium. No ifs, no ands, no buts. You got to pay that, right? $202.90 for 2026. On the supplement plan, you're going to pay additional premium for that supplement plan to take care of the 20%. Okay. Again, no network, any doctor in the United States that takes Medicare, no referrals are needed, but you will have to take a prescription drug plan in addition to the supplement to help cover your prescription drug medications. On the Medicare Advantage side, again, the Part B premium you pay, but the Advantage plan usually is no monthly premium, but you will have out-of-pocket costs when you go see the doctors because you're going to pay copays to hospitals and doctors. But there is a network, so you're going to stay in the network to make sure that you have the lowest cost. Typically, all your prescription drugs coverage is included in the plan, but you also get additional benefits that you don't get on a supplement side, which is dental, the vision, the gym, the over-the-counter benefits. So again, no wrong way. Whatever is best for you. And that's where we help guide you to figure out what's the best option for you. Now, one thing that is really dear to my heart, because I've had so many clients be diagnosed with cancer these past few years, it really has opened my eyes. Medicare does not cover cancer very well, especially on the Medicare Advantage side. So we always recommend a cancer policy for people on Medicare Advantage. These will help with your out-of-pocket expenses. And, Medicare doesn't cover everything when it comes to, cancer, prescriptions for cancer, all that stuff. So that's where these cancer policies help cover those additional costs that you may be exposed to. I even picked up a cancer policy because of all the recent diagnoses that my clients have had. It kind of lit a fire under me to say, hey, you know what? This is pretty common now. It's kind of scary. So we always look at that. Now, one of the biggest exposures in Medicare is skilled nursing coverage. Okay. So Medicare only covers 100 days if you're in a skilled nursing facility. Okay. Days 1 through 20 are usually at no cost. Okay. So Medicare usually picks up days 1 through 20. If after you have to stay in a skilled nursing facility after day 20, you will be responsible for paying $217 each day, up to 100 days. Now, what if you have to stay past 100 days? Well, unfortunately, Medicare says we're not covering you anymore, so 100% of the cost is on you. Okay, so this is where that if you had something catastrophic and you were not able to go home or you needed some additional care and it's over 100 days, This is where you need some additional coverage to help with these financial exposures that Medicare does not cover when it comes to long term care. So at the Medicare Gals, the signature team, we came up with some signature packages that kind of, help with the exposures of Medicare. So let's kind of go into them a little bit. Signature one, you can add a cancer or heart attack and stroke policy to help cover the exposures that you may be exposed to when it comes to cancer, heart attack, and stroke. Now, signature two package, you can combine that with a cancer, heart attack, or stroke package, or dental, vision, hearing package, or a hospital plan that helps cover the cost of a copay on a Medicare Advantage plan on a per day basis. Okay. Signature three plan is a cancer, heart attack, and stroke policy, dental, vision, hearing, a hospital plan to help cover those exposed copays, and it would add a recovery care plan. This would help the exposures of a skilled nursing facility if you were to be in more than 100 days, or short term health care if you were needing care at home or something like that. So these plans are all interchangeable. You can always pick and choose, add what you want. There's no wrong way, but you need to have something to help cover the exposures that Medicare does not cover. And that's why we kind of made these little packages to kind of get you thinking about some of the options. Now, we represent a lot of the insurance companies. So again, we're brokers. So as brokers, we are fiduciaries for you. So we look and see what's the best option for you. There's no one size fits all. We can look at one plan for somebody, and then your neighbor, we can look at another plan. So it really depends on all the options: doctors, prescriptions, medications, your how healthy are you, that kind of stuff. So it's really catering it to you to figure out what's the best option, and we have a lot to choose from. So I want to kind of break some myths about working with a broker. There's a lot of stuff out there that says, um, do you charge for your services? No, we don't charge for our services. We can't charge for our services. Actually, it's illegal for us to charge. So we are a free service for you. We do get compensated by the insurance companies to help you, but then you have a guide. You have somebody to rely on. So no fees are ever charged for you. Truth number two, the price you pay to the insurance company is the same price using a broker or going on your own. Now, if you go on your own, you have no one to help guide you. Whereas if you using a broker like me, that's where we are there to help you. Ask questions, help with claims, all that stuff. Whereas if you go on your own, you're on your own. And truth number three, we do work with a bunch of different insurance companies, so we're not biased. We have a plethora of options, and we just find out what's the best for you. So as we kind of wrap up the end, and I appreciate you sticking through this. It's a lot of information, but we are very focused on education, teaching you every day. There's something new coming in the Medicare world: rules, regulations, laws. We stay up to date on all of that. Oh, and yeah, I forgot to mention. So I am a co-author for a new book called 64 Plus Medicare Retirement and Planning. So if you want to get a free copy of this 64 and Plus book, I can send it to you, or I can send you the digital version. It'll just help you, emphasize more what we just talked about. If you haven't already, schedule your free consultation to discuss your situation with us. Get the expert help you need. Like I said, we're local. We know the doctors, we know the hospitals, we know the plans, we know what works in the community. So we are able to help guide you. And you will receive a bonus item. It's a personalized Medicare roadmap and a cost summary, and it will help you outline your monthly cost. And like I said before, we're not just a one and done. We are with you all the time. So you will get free lifetime billing and claim services from our client service team. So we pride ourselves in helping you with letters you don't understand, billing. What if you get a claim and you're like, what the heck does this mean? Or I lost my ID card. Can you help me with that? I need an address change, something like that. We are the first defense for you to do that. So we will help you. And if something we cannot help with, we would advise you to call the insurance company, but always reach out to us first. And of course, we are always, sending out birthday cards, holiday cards. You get newsletters from us. So we're always around and visible for you. So it's not hard to, forget us. And then every year we will review your plan with you, with our licensed agents, and we will find you the best option for you for the next year. If it's staying on your same plan or moving to a different plan, we will figure that out during your review. And last but not least, if you haven't booked yet, use the calendar down below and you can link to schedule with us. And we would love to meet you and we would love to help you because Medicare is so darn complicated that you're getting thrown 50 million things at you and you're like, whoa, what is right? But we're here to help guide you and we're here to help make this so much easier for you. And again, I'm Susan Shimp and I look forward to talking with you soon and y'all have a great day.